Thank you for listening. I'm going to cut this right to the chase, very short, to prove a point and hopefully give us the opportunity to move on to the next phase where we can work towards correction. Many people and many organizations claim they have the solution to the healthcare debacle in this country. They don't have anything. I have the solution, and although I am sure that statement has been made so many thousands of times, I am going to spend a very brief amount of time demonstrating to you analogy and example only of why my solution works, and then you can decide for yourself if you want to hear the remainder of the detailed solution, which I have 4.5 hours of lecture recordings that I have created to demonstrate multiple plans in different avenues and for different topics of how to correct this whole problem. This is not a complaint, this is solution. As a physician, I see the problems every day and I know the corrections of them, both hospital-based and private sector-based. And since I am also a human being, that means I am a patient as well in this nation, possessing and paying for my own health insurance. So I see the issues from that angle as well. I have been testing my solution or proposed ideas on many seasoned physicians over the years, and all agree. However, they all make the comment that this is too simple, this would be the ultimate solution, and the government would never allow this to occur. And the reason being, because frankly, it's not complicated enough, and the government wants red tape and complication to create jobs for officials in the government who are useless. Remember, the more red tape, the more government jobs exist. But again, I am only giving brief analogy and example, not details now. However, the details of that previous statement is in one of my lectures. If my plan is instituted, then physicians across the board, hospital clinics, providers, etc., will appreciate this plan, and above 90% of them should support it. To the same degree, patients across the board, competent citizens will support this plan. It saves money, brings better health care to them. Even the expensive big pharma or pharmaceutical companies will appreciate this plan and support it, being that it gives them as much profit as they already have now, and possibly and potentially even a little more, while saving money from the rest of the sector. It is a method that saves money and brings the same or better health care to a population who needs both of those items, a savings and improvement. I am going to spend a very brief amount of time explaining one element of why not only does Obamacare and the Affordable Health Care Reform Act fail, however, it is a farce, it is a fraud, and it is a method for the government and possibly previous President Obama to simply look as the savior for healthcare while doing nothing. And here is why. While there are hundreds and hundreds, if not more, of elements in Obamacare and the Affordable Health Care Act, I am going to explain one major component and why it is destined for failure. And it is not that the Trump and new Republican regime need to put an end to Obamacare. If they did nothing, Obamacare would fail on its own. It's not insurance. It's not coverage. It's a fraud, and here's why. Obamacare did not give insurance to people. It found people who were either underinsured or non-insured or did not have the money or funds to pay for insurance and give them the opportunity to purchase a less expensive insurance. And then, whoa, hallelujah, lo and behold, they have insurance. Wrong. They did not purchase insurance. They purchased a fraud. They purchased a plastic card that said they had insurance. So, the insurance carriers, what was the big deal to them? All they did is increase exponentially a deductible that the person has to pay before their insurance kicks in. And the algorithmic calculations of the population and the illness and the comorbidity states of the demographic was factored in, and it was discovered how high that deductible needs to be able to still retain income for the health insurance carrier while making it appear that health insurance was provided. But health insurance was not provided. Like I said, what was provided was a plastic card that may as well have said fraud on it, because the patient would then go to the physician or provider or hospital clinic and whatever medical establishment they needed, present their Obamacare identification membership card, and running the eligibility in the computer system, the front desk receptionist or check-in person would have to identify to this patient that their Obamacare plan had a $5,000 deductible. Many patients responded such as, "Gee, what's that? I didn't know what a deductible is. I never had that before." So a lot of people didn't even know what these deductibles were, and the medical establishment spent time, effort, and expenditure explaining what should have been explained by the Obamacare system in the first place, and that wasted a lot of time. But who cares if the medical establishment wastes a lot of time as long as the government doesn't? That's one thing, and that's a nothing. Here's why it doesn't work. When the patient is seen at the medical establishment is not supposed to charge them the deductible up front. In other words, when they check in at the front desk, if it is identified in the computer eligibility system that they have a $5,000 deductible of which no 1 penny already has been used according to their health insurance, so we know flat out 100% guaranteed that the bill for that day will fall onto their deductible category and they will end up having to pay it. The medical establishment is not supposed to charge that person the amount for their deductible ahead of time, or even to take a deposit for it, or even to hold a credit card on file for it. And while there is no distinct regulation that can't be done, it is a shunning away that it's not supposed to be done. So most medical establishments try to do that, and I certainly do not blame them for them. But the way the system was created is the medical establishment is not supposed to charge the person until after the Obamacare healthcare plan is charged by the medical establishment. Then the Obamacare healthcare insurance, if you want to call it that, makes a determination. This goes to the deductible, and then you have to send the person a bill. Right. You send the person a bill for the healthcare after the healthcare has been provided and after they are all better. Sometimes 3 or 4 months later, as it takes insurance protocol and red tape to take that long to make a determination. Sometimes the person may have moved, sometimes the person may have died, and sometimes the person may be in a worse financial hardship and not pay. Then, if they even respond, sometimes people need different payment plan options, and now you're turning the medical establishments into a financial institution carrying out payment options. But as long as the Obamacare plans and government didn't have to do it themselves, who cares what the medical establishments have to do? So the medical establishments are not paid for the work. then, after they are not paid, there are certain categorizations of people and certain insurances that end up red flagging in medical establishments, to where these medical establishments know from which patients with which insurance plans they have a lower likelihood of being paid. And there's other specifics, many of them, that I am not touching upon in this summary area right now, and I will in my future lectures. But these medical establishments know a high incidence of which people from which they will not be paid, and they stop taking some of these insurance plans. So now, a lot of these Obama plans are not taken by a lot of medical establishments. So little by little, there becomes less and less medical establishments for these Obamacare people to have medical treatment. It's like if you owned a grocery store and you knew from one specific credit card, whether it be Visa, MasterCard, Discover, American Express, whatever other ones there are, but you knew that there was one specific credit card that gave you a very hard time of being paid at your grocery store, and even though the person would swipe the card and it would go through as an immediate credit, later on in the month, the credit card company would notify your grocery store and either take back the payment or not actually put the payment into the bank of the grocery store. And if you, as the grocery store owner, knew there was a specific type of card that, although seemed like a valid credit card, functioned in the manner which I described, would you anymore, as the grocery store owner, allow your grocery store to take that credit card? Absolutely not. And no matter how much groceries you put on the counter, and no matter how much you told the cashier that if a customer says, I'm really hungry, I really need this food, but if they present with that card, are they going to be able to take away that food, those groceries, free of charge? You'll end up out of business shortly, and so will the medical providers. And then there won't be medical providers to provide health care to the population. So it had to be cut off somewhere. And these Obamacare plans and the recipients of such are some that are being cut off. And I am not suggesting any of this as the rich physician. I am suggesting this because I happen to be one of those people that have an Obamacare plan, but I had it by choice. I chose a high deductible plan because basic medical care coverage I don't need to go to a physician for. I am my family's physician. However, that was our own choice. That has nothing to do with this matter. But we chose a high deductible plan, and I've had such for many years. But now we've been put in the category of these Obamacare plans, and some specialty visits, which I have needed for my own family, have been cut off and denied because the medical establishment does not take the high deductible insurance plans. And I don't blame them. So Obamacare did not give insurance. Obamacare should have been upfront instead of being fraud, and simply made a regulation that stated to all medical practices, providers, hospital clinics, etc., you need to see, I don't know what the figure would be, 2 or 3 or however many patients per day free of charge who may be underinsured, and you have to fill out whatever form they could create. And I would have rather the government been upfront with me as a medical provider that say, you have to see 2 or 3 people per day free of charge, which, by the way, all of us do anyway. However, many more than that, because we're forced to see a dozen free of charge because of what happens with insurance, but that's besides the point. But as a physician, we volunteer our time a lot. None of you listening to this who have a regular salaried or hourly job volunteer your time the same way as physicians do. So let's not even go down that route. However, if the government came out and said 2 or 3 people per day you absolutely have to see for free of charge, then that would have been a more honest way of creating this facade of coverage, and that would have been a better method that the government could have had this coverage instead of creating this Obamacare fake fraud system. I would have rather as a physician, known up front what we are getting into. So that's why Obamacare doesn't work. And here is why all of the proposed corrections for healthcare reform and insurance reform don't work. Because they're backwards. Any retail business, any business at all for that matter, whatever product is made or whatever product is sold or service is sold, there is a cost to the business for that product or service. And then that product or service is sold at a cost greater than the bare cost to make a profit. The difference between the gross income and net income plays into identifying the success of that company. Now, every single business or successful business on the planet operates in this fashion. Even if I take a sandwich shop off the beaten path in some little dirt road town in Eastern Europe, they know this methodology. If they're selling sandwiches for €5 and they make a sandwich and it costs them €1, and everyone down the street, all the other sandwich shops are selling for the same €5, and they want to make more profit, do they charge more euros for their sandwich, or do they find a way to cut the cost of their sandwich, their product? That is proper business acumen. The reason why all healthcare reform, insurance reform is not going to work is because all we are doing is fortifying the arena that pays the exorbitant fees that can be reduced. Any business-minded individual will see that if we can reduce the costs of healthcare, then we don't need such high, crazy insurance premiums to cover what could potentially be lower costs. So instead of working on how the healthcare costs are going to be paid, regardless of what they are, work on lowering the costs. And my systematic methodology, ready for this? Underline it, lowers the costs of all healthcare across the board without, underline without about 12 times, ready? Without decreasing the quality or the availability of the healthcare provided, and in fact increases it. This seems impossible, but I have the answers as to how to do this. And it's amazing that it took me to come up with these answers, because this is normal business. Lower the overhead and make more profit. Period. End of story. Every single other business on this planet functions to achieve that. Why does healthcare not? And there is so much wasted expenditure that could be fluffed off the top that costs can be significantly reduced. I will give you one brief example again. This is one and only very brief example of one category. A person develops a big gash on their arm, bleeding profusely. They wait till the next day, they go to the emergency department. The emergency department cannot stitch them up. It's been open too long. They give them a prescription for a specific type of coagulant powder to put on their arm. Patient goes to the pharmacy for this 4-inch gash in their arm. They go to the pharmacy, they get the coagulant powder. They turn the prescription into the pharmacist. The pharmacist says, "Oh, I'm sorry, Mr. Jones. Your insurance does not cover the cost of this coagulant powder medication. But you know what your insurance does cover? It covers this." And he points to a box of large size absorbent bandages. And the patient says, "Well, that's not going to fix the problem." And he says, "Well, you know what? Your insurance will cover one box of these, and there's 40 in each box, and it'll cover one box of these every single day for up to a month. I just put it through your insurance, and I found out." And the person says, "Well, okay, If that's what my insurance covers, I'll take that. And the person goes home, they start using these bandages, these absorbent bandages, and every 30 minutes or so they have to change the absorbent bandages every day. And this goes on for a month. They go back to the pharmacy every single day for a month, get a new box of that stuff, and slap it on. And after a month, what happens is the person ends up still not healing, and they end up having an infection in the area. They end up septic and in the hospital through a hospital admission of 2 weeks long, and then have to get their arm amputated and end up going to a rehab facility afterwards, and now have become disabled from the physical job that they had. So now insurance expenditure and medical expense expenditure has been in the upwards of $70,000, if not more, and the person has become a Social Security disability participant for the rest of their life. Here's the clincher. That box of absorbent bandages only cost $5 each, and that's why the insurance was happy to pay for that. Remember, that failed after using it for 30 days. That coagulant powder that was not covered by insurance, I never mentioned the price for it because that question never arose. The cost for it was $25, but insurance wouldn't cover it, but it was $25. Had the person just purchased that outright, or had the insurance been able to make an educated decision based on recommendations of the physician, that coagulant powder would have been purchased instead, and the person would have never gone on to not only wasting all that expenditure from the hospital admission, but wouldn't have had to get 30 days worth of the $5 bandaging and spend $150 on the initial medication prescription as opposed to $25. This is one of about 50 examples, if not more, you are going to hear in my lectures. The difference being, in my lectures, I gave the solution and an exact protocol of what needs to be done to fix each and every issue. If you think that scenario was ludicrous, and you find validity in anything I have said, or you simply just appreciate the passion in which I am describing this, because I have been speaking about this for so many years, and it pains me that the solution is so easy and the government will not look at it in the correct fashion, then I implore you to please allow me to present to you the remainder of my information and proposal for the solution for healthcare in this once great nation. Thank you for listening.